I'm Adam, your friendly narrator and tour guide. Welcome to SPFVille, where hard-working prevention specialists have been toiling tirelessly to bring the message of prevention and wellness to their community. These dedicated professionals know their communities, find valuable resources, and design and provide fabulous programs with great results that aren't just here today and gone tomorrow, but become important parts of the SPFVille community. Why, here's one of these prevention specialists now. Meet Jimmy. OCPS2. Jimmy has dedicated his whole life to helping people avoid negative consequences.
Golly, this is such a great program for parents. Certainly everyone would want their children to be safe and healthy and free from tobacco, alcohol, other drugs, violence, gambling, bullying, and suicide. I bet the place will be so packed we'll have to make a whole other group. Shucks. This is so disappointing. All of that great information and no takers. Maybe I'm not such a great guy after all. Maybe I should just go work as a Maytag repairman.
Now, Jimmy. You have such talent and so many skills. The problem isn't your evidence-based, outcome-driven program. We need to get you out of the agency and into the neighborhood. Come along. We're going to visit a place called Prevention of Tomorrow.
Jimmy, we are now in the future.
Shazam, this is neato. What is this place?
Welcome to the medical neighborhood. This is your new home. This whole subdivision was built after healthcare reform.
I don't even know what that is. I don't think I belong here.
Jimmy, you not only belong here, you will want to be here. A medical neighborhood is the place where doctors and providers of primary healthcare get specialized assistance for their patients.
Adam, I'm confused. I'm not a doctor or a nurse. I work in an agency. I'm just a prevention specialist.
Well, there you go. You just said it yourself. You're a specialist.
I still don't get it. Can you explain it, Adam?
Sure. Let's start from the top, and by the time we come back to the neighborhood, you'll understand. The guides of the future aren't here in the medical neighborhood. They're actually over there on the top of the hill. It's called an Accountable Care Organization. They sometimes shorten it to ACO. They oversee the healthcare of all the people of SPFVille. That's a pretty big population. Their job is to find out what is going on with the health of everyone in town. They do surveys, interviews, and lots of other things to measure the health status of everyone in the population. A lot of times, an accountable care organization is a hospital or a large healthcare system. They take on the responsibility for getting the best health they can for everyone, and they want to do it in a way that manages their dollars most effectively. That means helping people before they get sick is really important. They want to prevent disease and sickness.
Well, mighty marvel, that's awesome. That's what I want to do too. And I know all about surveys and stuff. We prevention specialists do that when we do assessment.
That's right, Jimmy. You have skills that are very useful to the Accountable Care Organization. And guess what? Since you both do assessments, maybe you could join together and get even more information.
Neato! I didn't even realize I had such a great skill. I'm going to march right over there.
Not so fast, Jimmy. We have a lot more of the future to see. Our next stop is the next level of healthcare reform. It's called the Patient-Centered Medical Home.
Holy housing project, Adam. Do people actually live there?
Oh, Jimmy, you sure do love comic books. No, they don't live there. A patient-centered medical home is a team of healthcare professionals that make sure their patients get timely, efficient care. The key to a patient-centered medical home is coordination. Although they are usually headed up by a physician or nurse practitioner, there are lots of people who can be on the team. Nurses, social workers, case managers, nutritionists. It all depends on what the patient needs. They also encourage and support patients to manage their own care and take responsibility for their health. So it's not just seeing a doctor because you're sick, it's seeing a team because you want to stay well.
Golly, that's a great idea. But when do we get to see the whole neighborhood?
You're right on track, Jimmy. Surrounding the patient-centered medical home is a whole caring community. The medical neighborhood is full of specialists, heart doctors, cancer centers, mental health workers. These are all specialty practices. The medical neighborhood is full of specialists.
Hey, wait. I'm a specialist. I'm a prevention specialist. Well, I could do things like help their patients understand low-risk drinking choices to keep them from having alcohol-related problems. Or I could offer my parenting class right in the pediatrician's office. Those parents are already there.
Now you're getting it. And you have specialist powers that are going to be needed in the prevention of the future. You know how to get people involved and build up communities. You know how to plan special programs and make things work. What's even more important, Jimmy, is that you care about serving lots of different types of people. Different cultures, races, economic backgrounds. Prevention specialists have powers beyond their wildest imaginations, and they were here all along.
Zoinks! That's incredible! I do have special powers. But how do I get to the future?
Jimmy, the future is closer than you think. Here's some things you can do. First, you've got to become not only a prevention specialist, but a prevention scientist. You have to know that there is a lot of research about what works, and maybe even more importantly, what doesn't work in prevention. Not only should you know the research, you should be helping create new science.
Wow, a scientist, that's a nifty thing to be. Well, what else would I need to do?
Well, you need to get to know the people in the healthcare system and the unique ways they think, talk, and do their work. It's just like learning about a new coalition or going into a new school. They all have their own unique identities and ways of doing things, and you have to understand that and be respectful.
But how do I convince them that I belong in the neighborhood?
Well, Jimmy, if there's one thing I know about prevention specialists, it's that they are persistent. They also have great skills at figuring things out. But your persistence will only pay off if you can prove to them that you belong in the neighborhood. That proof is going to require a lot of data. And not just data about how many people attended your parenting classes, but data that proves what we both know, that prevention specialists change people's lives for the better every single day. As important as those things are, Jimmy, the most important thing is that you believe that you are a specialty healthcare provider. If you believe in yourself and what you do is valuable, I think you just might get to move into the medical neighborhood right here in SPFVille.
Shazam, I do believe!